A major barrier preventing the extension of health care to marginal populations, including immigrants, has to do with culture. Habitual practices, preconceptions, and fear can worsen health care conditions for many. Farm workers in Southern California face special challenges and risks.
I think the number one barrier is cultural, and cultural barriers are the number one factor that prevents Hispanics accessing health care through prevention, education, testing, and treatment. And the only way to overcome that is communication.
Language, the single most important tool to advance communication, can also be a problem.
Training personnel, medical personnel in bilingual medical personnel. There is a shortage in New Jersey. There may be problems in certain areas, and in the interview with NAMI, which I had the opportunity to participate in, it was clear that mental health, one of the main issues of mental health is not even access to just a psychiatrist or a psychologist, but a psychiatrist or a psychologist that is proficient in your own language. It's fundamental for the issue of communication, and we are facing that situation. Sometimes they are far from the area, and on top of that, they don't speak the language.
And cultural barriers create special difficulties in the case of sensitive conditions like AIDS and HIV-positive patients.
And there are many conditions that predispose or increase the risk of HIV amongst the Mexican migrant farm workers, especially in Mexico along the border, especially the border towns such as Tijuana, Mexicali, Ciudad Juarez. There's an increasing sex and drug trade industry that Mexican migrant workers can use, which will increase the risk of HIV transmission.
Immigrants seeking work as day laborers can become the target of sexual predators and human traffickers. Attempts to help them must break down fear and prejudice. Not only in California but everywhere else, community organizations can help to bridge cultural gaps. An example is the Puerto Rican Action Board, directed by Mario Vargas.
A lot of the clients that we do see in New Brunswick are undocumented immigrants. New Brunswick is a 5.2 square mile city where it has a lot of hair care facilities and the highest concentration, I believe, of Mexican descent in the state of New Jersey. We consider ourselves to be, what I say is like, you know, when you talk about the emergency room, well, literally, we are, I mean, figure of speech, we are the emergency room in the community, because often we are the only place that immigrants have to get some type of assistance, whether it's a referral, whether it's a screening for vision or for anything else. So that's who we are. That's the role that we play.